Maria von Kerkhoff, our technical lead for COVID-19. We have also Dr. Bente Nicholson, Director of Non-Communicable Diseases.
And studying vaccines, also in terms of planning how they would be rolled out and operationalized over time. Also in the very design of the COVAX facility. We've had a number of big conference calls that have involved many of the countries that are now signing up to COVAX, many countries from the continent who are providing their input as we worked out the details of the COVAX facility and designed it really together. So a huge contribution. And will continue to be as we go forward. Now, in terms of vaccine numbers and doses, remember the way that we've been discussing the use of these products that will come out of the ACT Accelerator, especially the vaccines. Our goal, our immediate goal, is to reduce the severe COVID, the burden of severe COVID disease around the world. Because if we can reduce the risk of severe COVID disease, then we can very rapidly, as a Director General emphasized, start getting back to a more open societies, functional societies, and rebooting our economies. Because it is the severe COVID disease which is generating the fear, and it's the severe COVID disease which is resulting in the loss of confidence, and whether it's in terms of individuals, in terms of employers, et cetera, that underpin the economic challenges we face. So what we look at is how much vaccine do we need to reduce the risk of severe disease. And as was described in the opening comments of the Director General, we have a better and better understanding of who is most at risk of the disease and most at risk of severe COVID disease. So we don't need vaccines for absolutely everyone right at the very beginning. What we need to make sure is, as we've said before, all countries get some vaccine, and that we use that vaccine to protect our healthcare workforce and care workers, and then to protect our elderly, and then protect the others who are at highest risk. And that can be done initially with relatively small quantities of vaccine as they come out and then grow over time. So the important thing is not what is the exact number, but how much vaccine do we need at the beginning to be able to reduce the risk of severe disease, because that's the key to removing the fear, rebuilding the confidence, and getting our societies and economies working again. And the 200+ million doses would definitely go a long way to achieving that. But right now we're a very long way even from that 200 million doses. So that's the key. It's been an important week, and we're certainly encouraged by what we're seeing again in terms of a tremendous solidarity to try and ensure we reduce that risk of the disease around the world and start getting back to a more normal way of functioning going forward. I think Soumya wanted to add.
Very briefly, just to add, I think Bruce has explained it very well. Just to add that the African Union has taken real leadership in this and engaged with discussions with WHO, but also with other partners on making sure that there's access to vaccine, the best vaccines for the African people, but also to be part of the development, part of the research and development process. And so the strategy for the COVID vaccines for Africa really has three pillars. The first one being very much to be playing a leadership role in the research and development of these vaccines, ensuring that clinical trials take place in Africa so that these vaccines are tested in different ethnic groups, different racial groups, age groups, etc., so that you have better estimates of how this vaccine works in different populations. Also focusing on expanding manufacturing capacity in Africa, getting into technology transfer and so on. This is building capacity for the future. And of course, focusing also on the policy, the implementation, and how delivery of these vaccines will take place. As we know that many countries face a lot of challenges in delivery even of routine vaccines to children, and this is going to be a vaccine that's going to have to be given to other age groups. This is not a childhood vaccine, so we're going to every country needs to start thinking about how these campaigns are going to be run and what is going to be needed in terms of human resources, supply chains, cold chain equipment, logistics, needles, syringes, etc., training, so that when the vaccine is available, that there's no delay in launching these immunization programs. Thanks.
Thank you, Dr. Swaminathan, and thank you, Bruce, for your answer. I believe Mike Ryan has something to add. Mike, can you hear me?
Yes, no, just to follow up, and just speaking with specific reference to Africa and to colleagues in Africa.
Sorry, Mike, you are very soft. Can you speak out, please? Speak up. Yeah. Thank you.
Yes, can you hear me?
Yeah. Try again, Mike. Thank you.
Hello?
Speak a bit louder or maybe increase your volume. I'm taking the...
I can't speak any louder, otherwise I'm shouting. So can you hear me now?
You are great. Go ahead.
I just wanted to reflect on the contribution that African countries have made in general to vaccination, and to congratulate Africa as a continent for the eradication of polio and the certification of that eradication. A huge task carried out with many years of effort, and both Tedros in Ethiopia and our RD Dr. Mweti and Bruce himself, was sitting there, championed a lot of the work that led to that. But also in the areas of cholera, in the areas of meningitis, in the area of yellow fever and Ebola. African countries have championed a lot of the techniques we use now for mass vaccination, for community engagement, and for really going after infectious diseases, particularly these epidemic diseases. So Africa has a lot to also share with the world. It's not just a beneficiary in this process. Africa has learned the techniques of introducing new vaccines, quickly against epidemic diseases, and in innovating in terms of implementation, in terms of logistics. And again, Dr. Tedros spoke to the situation of Ebola. It was African health workers, African scientists, who worked to bring the Ebola vaccine into the field, a vaccine that had to be transported at -80 degrees into the deep field, and given with very stringent oversight and data gathering and safety measures. Again, a huge triumph for African public health. So in this, I believe African countries, and particularly African scientists and African doctors and nurses, have a lot to tell the world about how we can introduce a vaccine against COVID in an effective way and at scale. Thank you.
Thank you, Dr. Ryan. There is no other intervention in the room. I would like to give the floor now to Peter Schilling from the European News Agency. Peter, can you hear me?
Indeed, thank you. Can you hear me?
Yeah, very well. Go ahead, please.
Okay. With all the schools opening up in most of the European countries now, there's a very big debate what to do and how to handle children. I want to refer to a publication that was made by the Massachusetts General Hospital and the Child Hospital that provided critical data showing an alarming twist with children, that they likely play a much bigger role in